Assalamu alaikum. This is the last lecture of renal pathology. We will discuss diseases of the urinary bladder. طبعا اليوم المحاضرة قصيرة وكيوت ما بيها معلومات معقدة مثل اللي أخذناها بالdiseases of the kidney. نبدي بالanomalies of the urinary bladder. Number 1, diverticuli. It is an outpouchings of the bladder wall. يعني there will be a formation of a sac in direct continuity with the wall of the urinary bladder. It arises as number 1 as a congenital defect, or it can arise as acquired disease, which is more common, usually in the setting of persistent urethral obstruction, whatever the reason. Benign prostatic enlargement, prostatic cancer, and female cervical cancer. The complication of diverticuli is number 1 infection, number 2 caliculi formation, وطبعا هذا سببه stasis of the urine, and number 3 is vesico-urethric reflux. So what is vesico-urethral reflux? Is the most common and serious congenital anomaly. It is a major contributor to renal infection and scarring. شلون يصير الريفلكس vesico-urethral reflux? Normally when the person wants to void يسوي urination, there will be closure of the urethral valve. فالopening تنسد هنا، فالurine will go out from the urethral opening يطلع للoutside. In case of malfunctioning valve, the urethral opening will be opened so the urine can reflux up into the ureter and even may reach to the kidneys. طبعا الكومبليكيشن مالتها هو الانفكشن، سواء السيستايتس or pyelonephritis يعني in the kidneys. The diagnosis of the vesico-urethral reflux is by avoiding cystourethrogram to assess the presence of a malfunctioned valve and to grade the disease. And the grade start with grade 1 in which the urine reflux up into the ureter, and grade 5 in which there is severe dilatation of the pelvic calyceal system with dilatation and tortuosity of the ureter. طبعا أنا أسوي الجريدينج حتى أشوف الابروتش اوف مانجمنت، هل هي تشمل لايف ستايل تشينج or trial of medical treatment, or we should approach the patient with a surgical correction of the malfunctioned valve. Inflammation of the urinary bladder, which is called cystitis. So there is acute and chronic cystitis. The common etiological agent of cystitis are bacterial، وخصوصا E. coli, Proteus, Klebsiella, Enterobacter. طبعا بطبيعة الحال women are more likely to develop cystitis as a result of their shorter urethra. Candida albicans and cryptococcal agent also can cause cystitis, but is usually occur in immunosuppressed individuals, like in those with diabetes or taking long-term antibiotics. عندهم HIV، ياخذون steroid، المهم عندهم suppressed immunity. Tuberculous cystitis is almost always, I repeat, almost always a sequelae to renal tuberculosis. Schistosomiasis, as it say, Schistosoma hematobium, is a rare in the United States, but is common in Middle Eastern countries like in Egypt. Viruses like adenovirus, chlamydia, and mycoplasma may also cause cystitis. نجي للموضوع المهم هو ال predisposing factors أو risk factors اللي هي طبعا presence of stone, urinary obstruction, diabetes mellitus, instrumentation like in Foley's catheter maybe, and immune deficiency in general. Irradiation also can cause cystitis and is called radiation cystitis. The presentation of UTI أو cystitis usually is frequency, يعني increase necessitation for urination. Number 2, lower abdominal pain. And number 3, dysuria, يعني burning micturition. And even the patient can be asymptomatic. Cystitis is sometimes a secondary complication of an underlying disorder associated with urinary stasis, like again as prostatic enlargement, cystocele of the bladder calculi or tumors. يعني أنا إذا البيشنت يجيني repeated attack of cystitis, I should consider the presence of an underlying cause that precipitate repeated attacks of cystitis. نجي للmetaplastic lesions of the urinary bladder. Number 1, cystitis glandularis and cystitis cystica. These are common lesions of the urinary bladder. تبدي when there is invagination of the urothelium اللي هو الابيثelium that covers the urinary bladder. Sometimes there is invagination of the urothelium into the lamina propria, so there will be a formation of a nest that is called Broun's nest. This is a Broun's nest. With time, sometimes the cells in the center undergo metaplastic change تتحول إلى columnar or cuboidal cells. This is called cystitis glandularis. And sometimes there will be flattening of the cells and formation of cyst-like spaces in the center, and this is called cystitis cystica. طبعا sometimes it is an incidental finding with no underlying cause, and sometimes it is caused by chronic irritation or infection of the urinary bladder. Number 2, squamous metaplasia, وطبعا occur as a response to injury. Number 3, nephrogenic adenoma, result when shed tubular cells implant and proliferate at sites of injured urothelium. Sometimes أكيد راح يصير sheddings of tubular cells. Sometimes there will be implantation of these cells at site of injury, forming a nephrogenic adenoma. نجي للموضوع المهم هو urinary bladder tumors. Most commonly due to transitional cell carcinoma. أكيد لأن أنا هو الابيثيليوم اللي عندي هو transitional cell. There is an increasing incidence of urinary bladder tumors. Males are affected more than the females. Incidence will peak incidence of age is between 40 to 60. Risk factors include: number 1, cigarette smoking. Number 2, industrial exposure to aryl amines. وطبعا sometimes the cancer appear 15 to 40 years after the first exposure. يعني late development of urinary bladder cancer. Schistosoma hematobium infection in the endemic areas like in Egypt or Sudan are an established risk. ليش؟ لأن الأوفا طبعا is predisposed in the أو العفو deposited in the bladder wall, and it incite a brisk chronic inflammatory response. فايش راح يصير هذا الكرونيك irritation and inflammation lead to squamous metaplasia. Sometimes the metaplasia will evolve into dysplasia and then to neoplasia. 70% of the cancer are squamous, the remaining being urothelial or glandular. Long-term use of analgesics is implicated as in analgesic nephropathy. Heavy long-term exposure to cyclophosphamide. الcyclophosphamide هو immunosuppressive agent and this drug can cause hemorrhagic cystitis and may predispose to bladder cancer. النقطة الأخيرة من predisposing factor أو risk factor for formation of urinary bladder tumor is irradiation. يعني مثلا البيشنت عنده pelvic tumor سواء ovarian in the uterus, in the prostate, and receive radiation therapy يعني radiotherapy. Sometimes this increase the risk for urothelial carcinoma. Clinically, the bladder cancer usually presents with painless hematuria, and sometimes the symptoms may overlap with symptoms of UTI. So the patient presents with dysuria, urgency, frequency, and hydronephrosis and pyelonephritis. Bladder cancer has a high incidence of recurrence, and the prognosis depends again and of course on the tumor grade and stage. Thank you very much. أرجع أكرر، اللي عنده أي سؤال بأي محاضرة من المحاضرات اللي فاتت أنا مستعدة للإجابة، وشكرا جزيلا لحسن الإصغاء.